This is a 27-year-old horse, very old, with a neurodegenerative pathology, PPID, Pituitary pars intermedia dysfunction, with cerebral lesions identical to Parkinson's disease. It is a pathology that causes excessive hair growth, general bad state, and in 6% of cases can cause blindness. As any neurodegenerative disease, age is the primary risk factor and progression of clinical signs occurs slowly. This subject already had an old cataract in the left eye, but had now lost sight in the other eye. In this case, a singular blood-derived stem cells intravenous injection was given, and after 40 days the horse regained his sight. "100 days later, the horse had lost 10 years and moved better than younger competing horses. Blood-derived stem cells have cured a neurodegenerative illness with only one intravenous injection. Hirsutism is the classic and most consistent sign in PPID. Other hair coat abnormalities are incomplete shedding and lightening of coat colour in aged horses. Hirsutism was found to have a positive predictive value of 90% for PPID. Here the symptom is very evident. Facial hair makes her look like a bison. Nasal discharge and eye inflammation. "5 days after first injection, some facial hair has fallen out. "20 days after first injection, her coat has become curly like a sheep's. "20 days after first injection, even less facial hair. "20 days later, curlier coat and hair loss begins near the tail. 40 days later, a 50% hair loss. "40 days later, facial hair almost normal. 40 days later, hair loss on the bottom. 70 days later, almost normal facial hair. 70 days later, a 90% hair loss. The degenerative pathologies of the cardiac muscle, myocardium, create a consequent functional deficit and the heart doesn't work properly anymore. This ultrasound shows the outcome of a dilated cardiomyopathy in a 5-year-old dog. It is phase 4, where the myocardium hardly contracts anymore and in a short time will be fatal. The dog received the only therapy available that is compensatory and cannot restore myocardium contractility. The dog was very tired. The yellow line shows the bad myocardium contraction. At this point, blood-derived stem cells were inoculated intravenously and under the skin around the heart. A non-invasive treatment lasting a few minutes. In a month, the pathology went from phase 4 to phase 2. This is miraculous because no drug gives this result. We repeated the treatment and the dog was checked 60 days later. Look at the yellow line. After 3 months, the dog is now phase 0 and has completely recovered his old vitality. Five months later, the dog's medicine has been reduced and the diuretics stopped. He has returned to his normal life. Dilated cardiomyopathy in human medicine often represents the terminal stage of ischemic disease, and the first thoughts of Giorgio Cagni, cardiologist that works with me, were the application of this therapy on heart attack patients. Until blood-derived stem cells for dilated cardiomyopathy will be used, the only treatment is the very expensive and invasive heart transplant. Another topic regards arrhythmia. This Doberman had many extrasystolic episodes, more than 20 in a minute. But after blood-derived stem cells injection, we saw not the reduction of these episodes, but their complete disappearance. And for arrhythmia, this is a new therapeutic horizon. This is a small 4-year-old bitch who had an emergency operation by an excellent surgeon for a slipped disc when her hindquarters were completely paralyzed. After surgery, she reacquired deep feeling, then was able to stand on 4 legs for a few seconds and take some uncoordinated steps. For 3 months there was a slight improvement, but even though she had regular physiotherapy, the dog regressed. The owner decided to try stem cells, and I injected blood-derived stem cells locally and intravenously. You can see her on the first day, 1 month and 5 months after the first inoculation. The result is miraculous.